Calcium deficiency. Calcium deficiency is common in children and adults and can invite a wide range of health issues in them. Don't ignore these warning signs of calcium deficiency. One of the essential minerals needed for healthy teeth and bones is calcium. It's necessary for the heart, nerves, and muscles to work properly. What is hypocalcemia and how does it affect our heart? Hypocalcemia refers to blood calcium levels that are too low. The following are some warning signs that indicate a calcium deficiency. Why is calcium needed by the body? Calcium is a mineral that can be found in food and is needed to make strong bones and do other important things in the body. It helps the development, structure, and strength of bones and teeth because it's stored there. Calcium, a mineral that carries an electric charge, is also one of the body's electrolytes. The mineral is necessary for the transmission of nerve signals between the body and the brain. It also makes it easier for muscles to contract and move, including the heart, to keep the heart beating. Additionally, calcium is required by most cells to facilitate the release of essential hormones and other chemicals, which have an impact on numerous body functions and in the blood to assist with normal blood clotting. There are certain signs and symptoms that can indicate a calcium deficiency in your body, and in today's video we will tell you what these signals are. Calcium deficiency causes the following symptoms in both children and adults. A calcium deficiency can be indicated by numbness and tingling in the hands and feet. Tiredness, a lack of calcium can result in weakness and make it difficult to complete daily tasks. Throat cramps, due to the fact that muscles lacking calcium are unable to maintain their normal tone. Calcium deficiency can result in muscle cramps, muscle spasms, and even muscle weakness. Seizures, because it overexcites the brain, hypocalcemia can cause seizures. Bone fractures. Low bone mineral density can cause osteoporosis, a condition in which a person's bones become brittle and are more likely to fracture. Itchy skin. Your skin may become dry because it's unable to maintain a healthy pH and retain moisture when calcium levels are low. Issues with gums and teeth. The body's lack of calcium causes gum disease and tooth decay to be common. Rickets. Children who have low calcium levels develop rickets and have their bones broken. Enjoying this video so far? Well, keep watching because there is a lot more good stuff coming up. But before moving on, don't forget to subscribe to our channel for more amazing videos like this and hit the bell icon so that you don't miss any updates. What causes a lack of calcium? A true calcium deficiency typically has less to do with your diet and more to do with underlying health issues like a problem with your kidneys or parathyroid glands, both of which can affect blood calcium levels. Typically, the body keeps calcium well, especially if you eat a lot of calcium-rich foods. Calcium levels in the blood are tightly controlled by a hormone called parathyroid hormone, PTH, and vitamin D in order to ensure healthy bones and teeth. Calcium levels can be affected by changes in PTH or vitamin D, and the lack of either can lead to low calcium levels in the blood. A deficiency in this essential vitamin, which aids in the body's ability to properly absorb calcium from the intestines, may be the cause of low calcium levels. Additionally, if they aren't managed properly, certain medications have the potential to disrupt the mechanisms that the body uses to absorb or excrete calcium. What happens when there isn't enough calcium in the body? If you don't get enough calcium, your body may begin to take calcium from your bones over time if you don't get enough of it. This causes a loss of bone mass over time, making the bones weak and porous, which can lead to osteoporosis, a condition with a high risk of fractures. In the body, if the body doesn't get enough calcium and vitamin D, a condition called rickets can develop in children and young people. Similarly, osteomalacia can develop in old people. As the heart muscle becomes less effective at contracting and pumping blood throughout the body, a severe calcium deficiency can also lead to heart problems. What kinds of medical procedures and tests are available? A blood test will be used to measure your calcium level for the initial tests. In addition, other minerals, vitamins, and hormones are examined in order to comprehend the reason for the calcium deficiency. In order to determine whether your kidneys are losing calcium, we may need to perform a urine test. A bone density test will be performed by your doctor if they believe you may have osteoporosis. This uses X-rays to measure the density and strength of certain bones, mostly the hip and spine, which indicates a calcium deficiency over time. Depending on the underlying cause, calcium deficiency treatments may include hormone replacement therapy. If parathyroid hormones need to be replaced because the glands are underactive, reducing or stopping the medication that is the primary cause. Are you getting enough calcium every day? Have you noticed any of these symptoms? Let us know in the comment section below. Takeaway: if your blood calcium levels are low, you may or may not experience symptoms. Depending on how severe and long you've had, hypocalcemia symptoms can be mild or severe. Frequent symptoms include muscle spasms and fatigue, numbness or tingling in the hands and feet, as well as irregular heartbeat are additional typical symptoms. Calcium deficiency can eventually weaken your teeth and bones. A blood test will be performed by your doctor to determine your calcium levels and the underlying causes of a possible deficiency. Don't forget to subscribe to our channel, like this video and share it with your friends. Thanks for watching!